My name's Matt Austin. I'm a hip and knee replacement specialist at the Hospital for Special Surgery. I treat hip and knee arthritis, which is commonly known as wear and tear arthritis of the hip and knee joints. My goal as a physician is to have patients return to their quality of life so that they can do the things that they enjoy, whether it's playing with the grandkids, playing golf, or doing things that are very active like skiing or surfing. I'm interested in computer-assisted surgery and robotics because these are tools that we use to improve outcomes for our patient. I think a lot of patients have the idea that the robot's actually doing the surgery. The robot just gives us information and allows us to more accurately deliver the outcome we're trying to reach. When a patient has decided to undergo surgery, I think it's really important that they understand the procedure they're about to go through, what the recovery process is like, so they have a reasonable expectation of what their outcome is going to be. I decide the right course of treatment for each patient by allowing the patient to tell me what their expectations are and how they would like to get there. And for some patients, it's non-surgical management. For some patients, it's surgical management. And I think it's really important to have that conversation up front. Many patients ask about same-day discharge after total joint replacement surgery. Most patients are eligible for same-day surgery, but not all, and it's important that we discuss that when you come to the office. Seeing success in a patient is tremendously gratifying. If you ask most joint replacement surgeons, that's why they went into the field. Someone has a problem, you fix it, and even though they still have to go through the recovery, you know that in most cases they're going to do quite well and be very pleased with their outcome.